I'm Serena, and today we're going to be going over a rehab program for lower back pain. So back pain can be caused by a lot of different reasons. It could be anywhere from acute to subacute to chronic back pain. And so what I'm trying to focus on is subacute back pain, and that normally lasts 4 to 12 weeks. And after doing some tests, the patient that we'll be seeing today, she suffered from some general muscle weakness. And whenever a person has weakness in either the hamstrings, the glutes, the hips, or even just anywhere around the lower back, it can lead to problems because your spine is having to carry a lot more than what it is used to. So like limitations caused by lower back pain, pain while sitting or standing for extended periods of time. You can have trouble sleeping, climbing stairs, kneeling or bending over, difficulties getting dressed. Really, if you have lower back pain, it does harm a lot of day-to-day activities and it can be very annoying. There are drugs that you can take to help ease the pain, but I think that, staying active and really trying to target those weaker muscles will help in the long run. And so the goal of these exercises is to strengthen the core muscle groups that do support the lower back. You're trying to improve mobility and flexibility, and you're trying to promote proper positioning and posture, because posture can also be a big problem that people have, and it could lead to pain either in the lower or upper back. And so staying active while experiencing low back pain, like I said, is always better than staying in bed. If your back is hurting and you just want to lounge around every day for a week, you're not going to get better. It might even make it worse, because normally when we're sitting, our low back is taking a lot of the load, especially if we're slouched over or in a crouched position. So what you want to do is not remain dormant for long periods of time, stay active, do either this routine or something else that a doctor or a therapist prescribes. You can either go online and find programs as well. But as long as the exercises and movements do not increase the pain experienced, then you're on the right track. So this here is my patient, and she's been experiencing some lower back pain for the last couple weeks or so. And so what we're going to do is a program that's going to strengthen the muscle groups around her back, because after testing her, I realized that she had some weakness in the muscles surrounding her back. So we're going to start off with a flexibility exercise, and for time's sake, we're not going to go through the whole program, as this would last maybe an hour. So I'm just going to have her do a couple of each, and then we're just going to run through it and I'll show her how to do them. So the first one is a single knee to chest stretch. If you could go on your back. And then what you're going to do is just bring your right leg to your stomach. And what this does is it stretches her back and her glutes, and really just gets a nice deep stretch. And then she's going to do that 20 seconds for 5 times on each leg. And then after this one, she'll do a double knee to chest stretch, and she'll bring both knees to her stomach. And this is an even deeper stretch than the first one. And instead of getting one side at a time, it'll just get the whole back. And then she'll hold this for 30 seconds and do it 3 times. And then after this one, if you could just bend your knees, stay laid down. You're going to do a lower trunk rotation. So you're just going to bring your knees to each side of you. And what this is doing is really opening up her back and increasing the mobility. And if there's any pain associated with any of these exercises, we don't do them or we modify them. So you can just continue doing that for a little bit. And then the next one is going to be a hamstring stretch. So the hamstrings do connect to the hips, and everything in that area can lead to some pain. So we're going to just make sure that we stretch everywhere. So if you can go ahead and you're going to use this towel as some support and straighten that leg out, yep. And then she'll hold this one for 20 seconds and do 5 times on each side. Now, if you aren't as flexible and you can't do this, what you can do is either stand up and put your leg in a chair and stretch your hamstring that way, or you can do a long sitting hamstring stretch where you're just sitting down with your leg out on a table and you just kind of reach for your toe. All right, thank you. And so now we're going to move into the strengthening exercises. I'll grab that towel from you. Thank you. And I'll give you this one. You're going to go back on your back. And this is called a towel squeeze. Normally you can do it with a ball, but I don't have a ball with me, so a towel works just as fine. And what she's going to do is she's going to squeeze that towel for a couple of seconds and then release. And she'll do that for 3 sets of 10. And this is going to work the adductors. Do you feel it, Mary?
Mm-hmm.
All right, great. I'm going to take that. And now what she's going to do is a pelvic tilt. And the pelvic floor, if you have weakness there, it can lead to some lower back pain. So she's just going to take her pelvis and tilt it upwards. And she's going to hold it for a couple seconds and relax. And this one is also 3 sets of 10. And then this will lead into the bridge. And I know that a lot of people might have some restriction when it comes to bridges, so she can do a bridge pretty well, but if you can't do a bridge, you can just go up as high as you can and make sure that you're engaging your glutes to make sure that you're still having the effects of the exercise. So you can go ahead and do some bridges for me. Make sure that your glutes engaged and your core is engaged. And this exercise also helps for posture as well as strengthening. And then the next exercise that we're going to do is marching in place. And this is a good one for people who don't have a lot of mobility, but you're just going to pick up your leg and alternate like you're marching. And engage your core. So this was a little easy for her, so if you want to make it harder, you can just do a bicycle, and that's a good core exercise. As well, if you have a weak core, then your back can feel the effect of that. Good job. And then next, what we're going to do is called a bird dog. And so this is a quadruped exercise, so she's going to go on her hands and her knees, and she's going to alternate kicking her leg out with her arm. And so what we want to focus on here is making sure that the spine doesn't rotate, but if you do have some weakness, then obviously this is a little harder of an exercise to do. You can go ahead and switch to the other side. Yep. So for someone who can't do this one, we obviously would just go to a different exercise. I wouldn't make anyone with extreme pain do this. And then clams are going to be next. So this one is for the hip. And so what she's going to do, she's just going to open up her leg and then do that 3 times 10. So 3 sets of 10. And this is for the side of the hip, and obviously we're just trying to target all the surrounding areas. And for this one, a lot of people, they do tend to rotate backwards as they're doing their clams. You really just want to make sure you're giving them verbal cues and making sure that they're not overextending or rotating. For this one, you want to make sure to put a pillow underneath their pelvis to make sure that their spine stays in a neutral position. And so what she's going to do now is to just alternate her legs and kick out, making sure that she's engaging her glutes. And these are just leg extensions. If she can't do them laying down, you can have them stand up and then just kick their legs out and like as they're holding on to something, because then gravity isn't working against them. And then you can stop doing that, and the next one is just a normal glute squeeze. So she'll stay with the pillow underneath her, but she'll just engage her glutes and then do that 3 sets of 10. Most of these exercises, unless they're stretches, will be 3 sets of 10. And then if a patient did have some postural problems, grab that chair for me. You can go ahead and target the upper thoracic part of the spine as well. So what you're going to do is you're going to sit down and we're going to do some scapular retraction. So you're just going to squeeze your shoulder blades. You can come forward in the chair a little bit. And you're just going to do 3 sets of 10. And make sure you're really squeezing. It's like you're giving someone a hug backwards. Yep. And so after doing that, the muscles of her upper back and her shoulders should be stronger. And for people who are hunched over like this, hopefully it gets them to be a little more vertical. And that's pretty much it. How are you feeling?
Good.
Great. Great. Thanks, patient.